What's up, everybody? Thank you so much for taking time out of your busy schedule today. It's going to be just a minute, and Dr. Mike will be joining us. We just got him connected. I hope all of y'all are having an amazing start to your week. How many of y'all are going to be heading to Las Vegas for Parker Vegas this week? Am I going to see anybody? Dr. Lawless. Sorry, y'all can hear that. That would be my laundry being almost done, so I can throw that in a suitcase and head to Vegas at 5 a.m. It'll be just another second before Dr. Mike joins us. You're not coming to Vegas this year. My heart is broken. But I do think I am coming to Dallas this summer, so hopefully we will get to catch up. Hi, Dr. Claire. How are you? There's Dr. Mike.
Hey, how are you? Nice to meet you.
You too.
Hi.
So let's see if we can turn your screen share on.
Oh, sorry. Thought I had it on. I'm looking at myself. Yeah. Am I not on?
There it is. I can see it now.
Okay.
You may want to put it in full screen though, so we don't see the slides on the side.
Got you. Okay.
I'm going to need him to come over here and help me with all of my technical stuff.
I get it.
Well, we're super excited, Dr. Mike. Thank you so much for being here. I will tell you that this is a hot topic when it comes to chronic pain and inflammation. I don't know if Cassandra and them shared with you, but we have well over 1,000 people who register for our webinars each week. And I woke up this morning to hundreds of people who are typically registered because they want access to a recording. And they wanted to email me to confirm that they would absolutely get the link to this recording because they were so excited that we were addressing this topic. So I'm super excited to have you here on the webinar series. For those of you who are not familiar with Dr. Mike, he's a nationally recognized expert in spinal disorders and pain management. I mean, because who else would we get to address this topic? He's also authored several scientific articles and 2 well-known books on back pain, including Back Pain Remedies for Dummies, while serving on multiple scientific and business advisory boards in the healthcare sector. He acquired Physician Therapeutics. He's very passionate about reducing the side effects of pharmaceuticals by bringing safe, scientifically proven encapsulated medical foods as natural alternatives for pain, sleep, obesity, neuropathy, fatigue, and cognitive decline. So again, can you think of a better expert to address this topic? I think not. So Dr. Mike, take it away.
Okay, well, thank you. Thank you. So this is an important subject that I'm excited to educate practitioners about, especially the chiropractic world, because when I initially became acquainted with these, they were prescription only. And the FDA has re-regulated this category of nutritional medical foods. And now you as chiropractic profession could bring them straight to your patients. So we're going to just go through this slide presentation talking about chronic pain, which you know is a significant medical and societal problem. We have an opioid crisis in our country right now, killing over 100,000 people a year in the United States for the last 3 years. And pain itself just has very high costs on people's lives. The medications that pain gets treated with again, highlighting opioids, have terrible side effects, but non-steroidal anti-inflammatory drugs, which are very commonly used and include ibuprofen and naproxen, also have a serious dark side and side effects that aren't spoken about as much. And, you know, I was very fortunate to come across this new category of encapsulated medical foods, with Theramine being the lead product, as a revolutionary tool to safely manage chronic pain and inflammation and not having the side effects of pharmaceutical medications. So just to speak a little bit about the physical pain caused, 100+ million Americans are daily affected by pain, with dramatic costs. There's three different types of pain. So there's acute pain, which you're all familiar with, and then there's subacute pain and chronic pain. So subacute typically is 1 to 3 months, and chronic pain is defined as lasting more than 3 months. In acute pain, the pain is typically very related to the tissue damage. So if you think of stubbing your toes, if you stub your toe, you get, you know, pain signals being sent up through the nerves into your spinal cord and up to your brain. And the amount of pain you experience is very equivalent to the stimuli, which in that case is banging your toes, having a lot of local inflammatory responses. As we get into pain lasting between 1 and 3 months, which is subacute pain, there becomes less of a relationship to the actual tissue damage. So other factors start to play in. And when we go to chronic pain, which lasts more than 3 months, it's not consistently related to tissue damage. So there's a lot of psychological and psychosocial factors that play into how the brain perceives the pain. So, you know, the pain actually hurts the brain, and the brain chemistry changes, and how you attribute meaning to the pain and how it's affecting your life are all impacting the processing of the pain. So chronic pain is a very difficult problem that puts limits on people's lives. Is this, you're seeing these slides go through, correct? Sorry to.
Yes, we are.
Okay. So chronic pain results in lots of problems: quality of life reduction, mobility reductions, activity of daily living, and then very commonly anxiety and depression, because when pain is persistent in someone, anxiety and depression are extremely common, as is obesity as a response to immobility and just eating for depression, and overall a poor perception of one's health. And then we deal with the problems with medications, which are the multitude of side effects, especially opioid dependence. Many people with chronic pain are also on antidepressants and have sleep difficulties. So you sort of get in a vicious cycle with chronic pain of pain, depression, immobility, obesity, medication dependencies, medication side effects, poor sleep, worsening depression. And these things really just feed on themselves. And a large percent of opioid-related deaths were related to a diagnosis of chronic pain and people going on opioids and getting a tolerance to them and taking more and more, and having concomitant depression and a variety of side effects. So we know this is a tremendous cost to our society. 8% of all prescriptions in the world are anti-inflammatory. So we're gonna turn a little bit, because people with pain commonly go to anti-inflammatories. In other words, first-line treatments are typically Tylenol or acetaminophen and drugs like Motrin. which is ibuprofen and naproxen. So these are extraordinarily widely used meds. And it turns out that they have all sorts of problems. So I'm highlighting here some of the dangers of non-steroidal anti-inflammatories, including gastrointestinal damage, kidney damage, liver damage, cardiac problems, thrombosis, bleeding problems, potentially chronic pain being worsened by anti-inflammatories, and potential damage to the joints. Gastrointestinal damage is by far the most common in the world, and in terms of side effects. So just to go down again, these are lots of the side effects that we see with anti-inflammatory medications, and we see a reduction of male fertility, potential for bleeding of the brain. Sorry about that, and some percentage of anaphylaxis. Acetaminophen, which again is super commonly used, that in and of itself also carries a long-term risk, and liver damage is actually a cause of suicide, is acetaminophen overdose, with people going into acute liver failure. So this turns me to what is the revolutionary option that I'm excited to speak to you about, which is approaching pain from a nutritional perspective with medical foods, specifically Theramine, which has had over 30 million doses prescribed over the past 10 years, safely and effectively combating pain without any of the side effects of pharmaceuticals. So again, I came across these in my practice. I was writing prescriptions for them. I was actually had a handful of medical chiropractic integrated clinics in Los Angeles. We had patients that we were able to reduce on non-steroidal medications very commonly by using Theramine, and also taking people down on sleep meds with some of our other encapsulated medical foods, and sometimes taking them down on their opioids, but commonly off or way down on the anti-inflammatory. So just to talk about Theramine compared to opioids or anti-inflammatory medications like Aleve or naproxen or ibuprofen, these are safe and effective for long-term use. They have tremendous human clinical trials where they were studied head-to-head against ibuprofen and naproxen for pain, chronic pain and inflammation. They're addressing a nutrient deficiency that is associated with chronic pain. And we have people that with problems like chronic back pain, chronic arthritis, that have safely maintained themselves on these for over 10 years. Now, I think I should take a step back and go into this category of medical foods for a moment, which are all natural molecules. The FDA categorizes medical foods as having GRAS ingredients, which means generally recognized as safe. CGMP manufacturing, which unlike supplements, which aren't regulated by the FDA and cannot make claims and do not typically have CGMP manufacturing, in these encapsulated medical foods, you know exactly what you're getting. Now, although they're not prescription only, they still require, on the label we write, requires physician supervision, because it is important people talk to their physician about these medications, including Theramine, so they don't quickly make changes to their own medication regimens. You don't want someone who's on a high dose of opioids just stopping them acutely. They could go into withdrawal. So these do require some physician supervision, that you as chiropractors could bring them to your patients as a safe alternative. And these medical foods are working through a patented messenger amino acid technology. And essentially what they're doing is providing amino acids, which are precursors to neurotransmitters, and then stimulating the uptake of those precursors. We're looking in this example of 5-HTP, which is 5-hydroxytryptophan, which is a precursor to serotonin. So we provide the 5-HTP with an uptake stimulator, an adenosine brake inhibitor, an activator of the neuron, and then an attenuation inhibitor. And this is through this patented messenger amino acid technology. And this allows us to deliver amino acid precursors with certain botanicals to increase the neurotransmitters that are deficient in a disease state. So I'm going to speak about that for a moment. Chronic pain and inflammation is a disease of the nervous system, okay? And theramine increases the neurotransmitters that are playing a role in transmission of pain and that are responsible for mitigating pain and inflammation. So that includes, we provide choline, which produces acetylcholine, GABA, which is an inhibitory neurotransmitter, 5-HTP, producing serotonin, as I stated, through 5-hydroxytryptophan. The theramine also, by us using arginine in these formulations, produces nitric oxide, which can increase gastric mucose and inhibit gastric secretion, which is keeping the intestinal barrier integrity. Unlike the anti-inflammatories, which obviously cause lots of gastrointestinal irritation and commonly gastritis and GI bleeds. So I want to digress for a moment and talk about chronic pain being a disease of the nervous system. It turns out in many chronic diseases, especially chronic pain, there's a depletion of several of these neurotransmitters at a cellular level. This was proven in laboratory studies. So it's sort of like, the increased metabolic demand of the disease state requires the cell to use much more neurotransmitters that are normally utilized in a homeostatic place when there's not a stress of a disease. So you could think of it like a car going uphill is going to be less efficient and require more gas, or a Tesla is going to require more electricity when it goes uphill because of the increased demand. So in chronic pain and inflammation, there's an increased metabolic demand and a relative decrease of the neurotransmitters. What we are doing with our encapsulated medical foods, and again, we have these for neuropathy, for sleep, for appetite suppression. We have them for osteoarthritis. We have a whole variety of medical foods. I'm primarily here talking about theramine because that is the lead product to address chronic pain and inflammation, which a majority of patients in a chiropractic practice will be suffering from. And many of them, including people who have arthritis, are probably using drugs like ibuprofen and naproxen. And this is the safe alternative. And again, it's working by producing the neurotransmitters through the amino acid precursors we provide and our technology, safely producing neurotransmitters, bringing them back to the optimal levels to let the body heal in its normal way. Now I'm going to go to some of the studies comparing nonsteroidals versus theramine. So in this first study, as you see, it was combined a 28-day double-blind study, randomized, controlled, multi-trial center of 120 subjects with chronic back pain taking theramine alone, and then theramine in combination with naproxen. And it turned out that the theramine was very significant over both naproxen and ibuprofen in this study. And the theramine, when you combined it with naproxen, was able to have the naproxen dose reduced by 70% and get the same effect. When you reduce an anti-inflammatory substantially by combining it with theramine, like in this study, you'll reduce like 98% of the side effects because they're mostly dose-related. So again, theramine gives your patients a long-term safe option to treat this chronic pain and inflammation and lower the anti-inflammatory doses or potentially not need them at all. So again, why does it lower inflammation? Potentially the nitric oxide that's produced by arginine has a prostaglandin-like protective effect. And that might be one of the reasons we also don't get the side effects with theramine on the GI system. So theramine's a great option to pharmaceuticals in that no side effects, low cost, high efficacy. Non-steroidals have very significant dangerous side effects. And overall, that's going to result in higher healthcare costs, especially when you include complications. And opioids, we all know, which are a last resort for managing chronic pain, result in, considerable side effects, including addiction, which is a global problem right now. So theramine, certainly for people over 65, should be a first-line treatment because it's effective and safer than nonsteroidals. And again, 43 million doses. We have 0 reported GI bleeds. So a very low side effect profile compared to opioids and nonsteroidal anti-inflammatories. It should be the preferred first-line treatment for all chronic pain, inflammation, especially of the back and the joints and the neck. And it defines, really, as an example, a new space in healthcare of nutritional medicine. Again, supplements can be great, but they're not regulated. It's very hard for you and for the public to discern. Most supplements are based on theoretical scientific mechanisms, not on human studies. Human studies are the gold standard. So we have double-blind studies here comparing theramine to the most commonly used anti-inflammatories, showing their safety and effectiveness. Supplements, you also don't know about their manufacturing, and many of them, it turns out, in many independent studies, did not have what was claimed to be in the bottle. Our theramine uses certified good manufacturing practices, and you know exactly what you're getting in these combinations of amino acids and botanicals, which have no side effects for you. So it's a new revolutionary approach to chronic pain that I'd love you to bring to your patients. We also have medical foods, as I mentioned, for sleep. We have one of them called Centra PM, which we're offering to the chiropractic profession as well, and we'll be at the Parker Convention this weekend. The Centra PM, which works for sleep and sleep with depressive symptoms, was studied against trazodone. And again, it helped actually enhance parasympathetic tone, regulating the sleep cycles, having a lower sleep latency, so people were falling asleep quicker and weren't having any long-term side effects that you commonly get with sleep meds, which might include confusion, daytime fatigue, decreased mental acuity, and decreased memory. So again, that's a nutritional approach to chronic sleep disorders. We have both Centra PM and Gabadone, and a number of other products. We have a product called Percura for neuropathy, and we could potentially circle through with some of these on another presentation because neuropathy is a very difficult problem, and it's great to have a nutritional solution. Again, producing neurotransmitters, using amino acids, which is a safe, effective alternative for neuropathy that is certainly worth trying, as most people are on gabapentin, Neurontin, which can have significant side effect profile. So I would advocate learning and considering more of these medical foods. I'd like to switch to some other slides. Would you be able to help me just put our regular deck up with all our, or I could come back to you for a moment and we could just chat if that works. Hi, are you with me?
Yes, sir. We actually have a couple of questions.
Yes, great. So we could answer questions and take it from there.
Well, the first one is this safe for celiacs? Needing it to be completely gluten-free. It's unfortunate how many prescriptions and over-the-counter supplements contain gluten.
Right. So These have been prescribed in 43 million people without any adverse side effects. I don't believe our theramine contains any gluten in it. So I've prescribed it for many years. Could you check on the bottle, because I'm 98% sure there's no gluten in it, but I will do my best to get you that information in a moment. Never had the question.
Well, the next one is, would this also help with the pain and stiffness from DISH, diffuse idiopathic skeletal hyperostosis?
Yeah.
Angela, girl.
I mean, no, I'm familiar with the disorder. I mean, we've had people with any and every type of chronic ailment of pain, many of them which have an anti-inflammatory component to them, respond in some capacity. So again, there's zero downside to trying it for people. It's only an upside because it's perfectly safe. And in many people, it might work somewhat. We tend to tell people give it a month or two, because people who have chronic pain, their neurotransmitter levels that mitigate the pain pathways take time to get replenished through these amino acid precursors. But yes, I would definitely try it with people with DISH.
Wonderful. And then we also got questions about fibromyalgia and AS.
So I treated many people with fibromyalgia with a protocol of medical food. So people with so yes, theramine has worked very well in many patients with fibromyalgia to help with the chronic pain and inflammation. Fibromyalgia patients also commonly have sleep disorders. So one of the former chief medical officer of this company before I purchased it was the chief of rheumatology at Cedars-Sinai. He was another UCLA professor, David Silva, and he developed a protocol for fibromyalgia that worked extremely well for many patients. And I think he published a study on it, but it basically included Centra AM, which was used in the morning for cognitive decline and fatigue, because many fibromyalgia patients have low energy and fatigue. So it was Centra AM in the morning, it was Centra PM in the evening to regulate their sleep and their autonomic nervous system with better parasympathetic balance. And then it was theramine 2 tablets twice a day. So it was a protocol of Centra AM in the morning for the fatigue, Centra PM in the night to regulate sleep and autonomic balance, and then theramine 2 tablets 2 to 3 times a day for the chronic pain.
Wonderful. How does this work with the use of turmeric taken at higher doses for inflammation and pain?
It turns out the data on turmeric is not great as one would think. I mean, there's people who combine this with turmeric and do fine. So there's no cross reaction or interactivity. I mean, this has much, much, much stronger human data than turmeric. So the turmeric's a supplement. I believe there is some role, and some people respond to chronic pain or the inflammatory. Actually, it's really the anti-inflammatory component that may work in turmeric in some people, but this has much, much stronger data, and there's absolutely no problem combining them. You know, this is really straightforward science when you have human trials.
Let's see. I have never heard of this product before. So my question is, I use standard process, which is whole food based. Is this made from food, or why is it called medical food?
So again, this is an FDA regulated product. It was and in terms of you not hearing for it, it was prescription only, okay, for many, many years. I purchased this company, dropped the price from what was being reimbursed at $400 per bottle by insurances, by prescription. I'm bringing them to chiropractors for like, I don't know, $25 a bottle to sell to their patients for double that, something in that realm. You know, we retail these for $60 a bottle, but the reason you haven't heard of it is because the company was prescription only going through insurance. And I just purchased this, and we're just really rolling out to the chiropractic profession with this. So, and in terms of, I mean, these were being sold by full scripts with the prior company. We're going directly to the chiropractors because we'd rather give them a much bigger margin where they could double the price of their patients and we could retain our margins. And then these are all amino acids and botanicals. So just to be straightforward, they're all the FDA regulates these, and they say the ingredients have to all fit under the category of GRAS, generally recognized as safe, which are either going to be vitamins, minerals, botanicals, certain herbs, amino acids. That's what we have in our products. The ingredients in great detail are all on our website, medicalfoods.com. And I could be reached at Dr. Mike at medicalfood.com. But, there's very detailed science and white papers and almost 15 years of history documenting safety.
Wonderful. How effective is Theramine for neuropathic pain versus gabapentin? Ooh, my glasses.
Yeah. So no, I prescribed, unfortunately in my pain practice over the years, I had to use gabapentin quite a lot on patients. And it worked in a good number of patients. It stabilizes the membrane. However, many, many people had side effects of confusion, of daytime fatigue, of memory loss. It could be a tough drug from a side effect profile. So we have actually a specific Theramine. I had many patients with neuropathy on Theramine. Sometimes it would allow me to lower the dose of gabapentin, which was great because that would typically lower the side effects. Some people were able to get off or just couldn't tolerate gabapentin, and I have them on Theramine. But I would typically use Percura, which we had an additional medical food, which was indicated for the dietary management of neuropathy specifically. Theramine is for chronic pain and inflammation in general. And I had a number of patients on both Theramine and Percura because Percura was specifically indicated for neuropathy. And it was, again, an amino acid-based medical food, and Theramine was working on chronic pain and inflammation. So these can be combined. There's no problems with drug interactions with the drugs they're taking, like gabapentin, and none problems with interacting with each other.
Wonderful. And do y'all provide the protocol for medical foods to providers for various conditions like Theramine would be good for?
So again, if you think of a medicine like ibuprofen, people with anything and everything are taking, if you have headaches, you're taking ibuprofen. If you have neck pain, if you have back pain, if you have osteoarthritis, you have rheumatoid arthritis. So Theramine is for the dietary management of chronic pain and inflammation globally. So any disease with chronic pain and inflammation, I would recommend getting at least up to 2 Theramine twice a day. We have some people who have long-term, real bad chronic rheumatoid arthritis, and they've managed with taking up to 2 Theramine 4 times a day because there's no dangerous, because it's purely nutritional. But the protocol is standard based on the disease, or in this case, the symptom of chronic pain and inflammation. And that goes for any type of chronic pain and inflammation. And yes, we have, continuing education credits for the chiropractors available. We offer free 6 credits that we're offering at the Parker Conference with a whole digital program explaining all the details of how these work, medical foods education for each of the disease categories that we treat.
These questions make me so proud of my little chiropractic students. So chronic pain is very high in the military. Have you thought about marketing this to Veteran Affairs DCs and other naval-based hospital pharmacies who are treating active duty and veterans?
Yes. So we had a big meeting yesterday. We are involved deeply in that. We have a big distributor through the Veterans Administration that wants to bring us onto the formulary right now. And I've treated quite a number of vets with these, as have a number of docs back when they were prescription only. Now that they're not prescription only, we have to create a demand. So we're going with some initiatives to educate veterans, but whoever asked the question, or any of you who want to help with these initiatives, we just made some donations. We're very passionate to bring this to the world of veterans and educate them, because we also have protocols for PTSD, which work well, for sleep, for neuropathy. So the veterans will benefit from all 7 of our medical foods with a variety of conditions, and many of them have. I used to run the pain clinic at the VA in Los Angeles, and this is something I'm very passionate about bringing out to the veterans.
Does your integrated model include meditation? And is there any data related to medical food and meditation combined?
Well, my integrated prescription for life for everyone includes meditation and yoga and good sleep and eating right and exercise. So, meditation clearly is quieting the brain. We are approaching all these diseases by balancing the cells and using neurotransmitters. So, they would obviously work very well in concert. There's not been a study on theramine and meditation, but I could tell you I've had a lot of people who meditate who take theramine. And anyone who meditates for pain problems or for most health problems is likely doing themselves a great service. I'm a big advocate of it.
I am too. That was a great question. Thank you, Dr. Don. Let's see. Oh, my dear friend, Dr. Lawless, she says, I am a vet and I treat vets in my office. This is awesome.
Amazing. I'm excited to work with you. Please reach out to me, Dr. Mike at medicalfoods.com. We'll get on a call because I need some more people like you who are going to help educate them. And this is really exciting initiative we're about to pursue in the world of veterans for these. We want to get them to everyone. And we think chiropractors are a great profession to help distribute because many of you work with supplements and these have much, much stronger science, and you weren't able to bring them out when they were prescription only, and now you can. So for many diseases.
I was going to say, one of our future chiropractors who is watching this also is she is the wife of, oh, I lost it. And now I feel like I should have just remembered that. She's a Navy wife. I knew that I was going to say that. But anyway, she's also, I just told her, I was like, make sure you reach out to Dr. Mike.
Mm-hmm. Yeah, I mean, we're launching a Parker Chiropractic this coming week. And, I think it starts on Thursday because we're setting up on Wednesday. And we really are offering some great packages for people to have not only a great passive revenue stream in their practices with customized websites, but really help their patients in this safe alternative to pharmaceuticals and really bring them something very innovative in nutritional medicine. And it's very easy, low learning curve. And they'll get free CE credits for learning it.
Wonderful. Are these vegetarian capsules?
No. When we grow the company, maybe we will switch to that. We are a startup.
Y'all are so active today. I can't remember a time when y'all had so many questions. Actually, I do. We were talking about 2023 changes and with Medicare. Let's see. What else y'all got? Oh, you're welcome, Sophia. All right.
This also gives people an opportunity to open up areas with patients that they're not seeing regularly anymore that may have chronic sleep. They may have been coming in for their back or their knee. They also have chronic sleep problems. They also have cognitive fatigue. Fatigue and cognitive decline. Their parents might have problems. So chiropractic practices offering this could really expand the market. Obesity, we have natural appetite suppressants that treat cravings. So we've had chiropractors use these, and we help them with a marketing program, go into other channels to activate older patients and create new markets because we could treat so many things naturally here.
Wonderful. And I just did pop in here that your booth number is 935 in Las Vegas this weekend if they're going to be there, to make sure they stop by and ask questions in person. And I know my ladies and gentlemen, they think of questions like 30 minutes after we wrap up and 2 days later.
I want to let you know, Dr. Fab, who's a big advocate, has been helped by these and is on our team, is going to be at our booth most of the time. And, we have quite a bit of free giveaways as well. People could come by the booth for, products, and he's giving away a course. So, and we have our free CE course.
Let's see. I don't remember. Does the glutamic acid in some of the products potentially raise glutamate levels and possible side effects from that?
No side effects. I mean, again, natural neurotransmitters, and this is raising it to a level of balancing it when it's deficient.
How have you seen this work post-injury, for example, in VA?
Yeah, I mean, again, I've had people, post injury. I've taken care of an enormous amount. Motor vehicle accident, MVA, right? That's what they're referring to. So treated a lot of people with chronic whiplash with this, with chronic back pain over the years. Again, people who don't want the side effects of non-steroidal anti-inflammatories like ibuprofen who get gastritis. So, and sometimes we combine them with these and just use a much lower dose of the pharmaceutical. People could get their sleep medicine sometimes down to, a quarter of the dose by using Centra PM or Gabadone.
Okay. Is this product for diabetic neuropathy? I currently use Evening Primrose. That does work, but they still need the gabapentin.
Yes, I would definitely add neuropathy medicine Procura that we have, which is on our website. Again, you can see everything at medicalfoods.com. So Procura works well for diabetic neuropathy in a good percentage of patients, and Theramine as well. I mean, I've had people on Theramine and Procura. But again, if people could help get down on gabapentin, you want to give whatever shot you can to some natural alternative.
Is there an online portal for patient orders?
Yes, there is on our website, but we'll also set you up with a customized website. And I mean, look, we obviously are trying to get these to as many people out there. So feel free to have your patients go to our website and order them off medicalfoods.com. But I'm also encouraging you all to sort of bring these into your practice. Number one, in which case you could make a lion's share of the revenue. And number two, you'll have a really nice business and be able to help many, many of your patients. So if you want that, just contact us at medicalfoods.com. We will get you set up, and we're setting a number of chiropractors up with their own in-office businesses, and we have Chiropractor One, who's one of the biggest distributors in the chiropractic field. He's going to be distributing, and we drop ship directly to patients, so you don't have to carry the products in your office. We'll have a kiosk for you. You could give them links. They could go to your website, and we'll drop ship the products nationally.
Will the specific quantities of nutrients be available? It doesn't seem that that's available on the website.
Well, they're proprietary formulations, right? So there are ingredient lists of what ingredients we have. They are on the website. You have to hit the product itself and then go to learn more. So we do have it, and we have it on our labels as well.
Wonderful.
And I could give anyone whatever information they want because I have oodles of information. But again, the areas of, chronic pain and inflammation and sleep and fatigue, these are things you see in your practice every day, and obesity, of course, and cognitive decline. So neuropathy, like this is a whole way to use an FDA regulated product line that is all natural and could treat diseases nutritionally by balancing the body and promoting natural healing. So it's going to enhance anything you do as a chiropractor, which is, again, alignment, freeing up the spine to transmit good nerve signals. This is helping the nutritional aspect of the nervous system as well.
Wonderful. Okay, guys, do you have any other questions? Anything else you'd like to add?
I mean, I'm just passionate. Everyone knows supplements and everyone knows pharma, and this is strong, safe science in between supplements and pharma that is proven in humans. So all you have to know about this is that there's human studies with 10 years of data showing it's safe and it works. And, I almost feel, when I was teaching doctors in orthopedics and primary care as a UCLA professor, I would literally say to them, if your patient has chronic pain and inflammation, you're doing them a disservice if you're not offering a safe option to treat the disease nutritionally that has no risk to the patient. So I feel that way about all these products: sleep, pain, anxiety, depression, cognitive decline. We have a whole host, and I'd love to be part of your profession helping bring these to the world, because we're really starting our focus on chiropractic. So I encourage you all to reach out to me. I'm glad to hop on a call and come visit us at Parker.
Wonderful. Lots of kudos. Thank you so much. This is awesome, and I'm excited. We'll be sending an email so that we can talk soon. Christy, you know we have questions 40 seconds after the webinar. If you email me, I will forward them to Dr. Mike and his team. Angela, girl, come on now. Dr. Mike, I appreciate you so much and can't wait to meet you. I'm sure, like a lot of other practices, we treat patients that experience blood clots and are on NSAIDs or other blood thinners. Do these supplements interact with blood thinners?
No, and that's what's very good. You could treat people with kidney disease, with bleeding problems, blood thinners, heart disease, no concerns at all. That's what's very unique about them.
Awesome. And again, I put on there, his booth number is number 935 at Parker Vegas. ChiroHealthUSA will be at 605. Wow. I know Dr. Mike's booth number. I think I know my booth number, but you can't miss us. So make sure you stop by both our booths this week. Say hi to everybody. We cannot wait to see you all in person. And I'm going to go find Dr. Mike's booth. So if you see me and you can't find it, holler at me and I will walk you over there. So everybody have an amazing rest of your day, a fabulous week, and know that we will reconvene after we all cover from a trip to Vegas. And we will have, y'all know, my bestie, Dr. Jay Greenstein, back. It's been a while since he's been here. And we're going to be talking about an evolved approach for building a successful practice. And y'all know that his greatest hope, his greatest burning desire is to help people, to other chiropractors, to build very successful practices. So make sure you register for that webinar on March the 7th. I'm trying to get him to wear a party hat because my birthday is a couple of days later. Let's see if I'm successful. Can't you imagine that big old fro and a party hat? It's going to be fantastic. Make sure you go to the website at ChiroHealthUSA.com/webinars to see all of the upcoming webinars. We've got them posted all the way through June. And if we're not addressing a topic or have a speaker that you would like to see, make sure you email me, Christy at ChiroHealthUSA.com, and tell me what you want. So everybody, again, amazing day, fabulous week, and I will see you back here with Dr. J on March the 7th. And Dr. Mike, I will see you in 2 days.
Yeah, thank you so much, Christy.
You're welcome.
See you at Parker. I'd love to meet Dr. J as well because of his teaching on that. We have something great for him to recommend to practices, and that these people get a beautiful web-based business that we could set them up on.
Well, he and I have set up some time to go on a walk throughout the expo hall. I want to say it's Thursday. Maybe it's Friday, but we will come by and see.
Sounds great. Look forward to it. Thank you.
Bye.
Bye.